hard. All right, so chapter 1. What chapter 1 deals with is kind of the basic definition of the microanatomy that we're going to be going over. Also goes into some of the systems, just a basic overview. And then what we're going to be discussing are directional terms. We as technicians need to be able to convey directions to each other. We have different anatomical planes where we are separating the body, top from bottom, left from right, back from front. We also have directional terms that would help you as a technician. So let's say that I am the technician on the morning shift, or a technician from weeks ago, and I had an animal who had a growth removal, super furry animal. I need to be able to tell you, the next technician, in my notes, exactly where and how to find that little growth. So we have these directional terms. If it's moving towards the head, it is said to be cranial. If it is moving towards the back, it is said to be dorsal. So we're going to be going over all of these directional terms. When we get back on class on Monday, I'm going to teach you some interpretive dance to kind of explain and get you moving, get those pathways. Movement is a wonderful pathway to get that little grain. Oh, it's okay if you can't dance, Alex. It's okay. It's interpretive. It's interpretive. So it's whatever you want it to be. Don't worry. It's okay. All right. Excuse me. My allergies are gone. Cuckoo for Cocoa Puffs today. All right. So this is, I'm going to move you guys. See, this is the other thing I love is I have got 3 screens, so I can move you guys up here. And now I can still see you all. I love it. Love it. Love it. And I need to get my chat. Sorry, too much going on here. There. All right. And I need to back this up. So this is the PowerPoint chapter 1. It is on my Moodle. I'm hoping all of you have successfully got access to the Moodle. I am also pretty sad to say I still have about 30 people who have not emailed me their email address. So you are not receiving informational emails from me because I have not been able to input you into our email system. So if you are one of the people, I'm not calling anyone out, but if you are one of the people who has yet to send me an email, do it, please. Otherwise, you're just, well, I mean, you don't have to, I guess, just don't get emails from me. And some of those emails are kind of important. So just please, 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 in a week. All right, so let's talk about chapter 1.
I have a question, actually.
Yes.
So I never gave you my email, but I received an email from you. So
I don't know who's talking, Giselle.
Yeah.
Did you, okay, you may not have sent me an email regarding your email, but did you send me an email about scrubs or about any other things or about your Moodle?
No, ma'am. I just I thought that you already had it because I already got an email, so I guess I didn't know if that was just you already had it or. Okay. I was just wondering because I was just is she directing this towards me?
So for me, if you're receiving emails from other instructors, they may be doing it through Moodle. I have a secondary backup email system.
Oh, okay.
So we are able to email through, in fact, here's what I'm going to do right now. Here's what I'm going to do for everybody who has questions. I am going to send everybody an email from my backup email. And if you do not get an email right now, you are one of my culprits who needs to get on it. All right. I'm going to be sending this, and it's going to say test, test, test. And I'm selecting the rubies, all continue. Yeah, only 47 people. And in the body, I'm going to thank the people who did, because if you didn't, then you don't get a thank you. Sent. All right. Now on this, that's a great question. So on this PowerPoint, this is not a testable materials PowerPoint. The stuff in red is just to remind me to kind of hit on some information. Unless it says specifically in my Moodle testable material, it is an all is fair game. Now, what I do though, we will be teaching the PowerPoint. As I said earlier this week, I don't pre-schedule my tests. We take as much time as we need to take on this material. And I don't do my tests scheduled like we would never finish this PowerPoint and I go, okay, we're having a test on Monday. I will always give a school day in between us finishing a PowerPoint and doing the test. And then I schedule in time for review so that we can just kind of go
thank
over.
God.
Yeah, I do schedule in not a whole class period. I'm not reteaching the whole lesson, but 5 or 10 minutes just to let everybody have time to have gone through the PowerPoint. Remember what I said, you're going to go through and you're going to decide, do I know this or do I not know this? And if you don't know it, you bring it to class, I help you through it. And in fact, I do that every day. How I start my class every day is with what I like to call a wee bit of review. So we will be going over all the major concepts from the day before, get our little dugs warmed up and ready for anatomy. So this is just a general introduction into what we are going to be covering. The first 8 weeks of anatomy is what we call microanatomy. So the first thing, we're going even smaller than cells. We're going to talk about the components of an atom and how do these atoms bind and bond together to make molecules, and how do these molecules come together to make cells, and how do the cells come together to make tissues, these tissues come together to make organs, and then the organs work together to make systems, and these systems work together to make you. So this first 8 weeks, we will be covering everything up to and including tissues. We will be getting into, probably at the end of the 8 weeks, we'll start dabbling with a few of the systems, like the skeletal system. We may be able to get into the muscular system. And so, yeah, everybody's out looking for their emails now. If you don't have one, shame on you. I publicly shame on you right now. I just say it. All right, so why is it important that we are able to know these animals on such a microcellular level? Well, that's kind of the whole point behind being an LVT. We are different from someone who is trained on the job because we do have the education behind us. In order for you to be able to identify abnormal, you must first be able to identify normal. And that's kind of what we are doing here. So what is the definition? Anatomy is the form and the structure. So basically, anatomy is the parts, the engine. How does it, or what are the parts that make it work? Physiology is how does it work? So anatomy is the parts, Physiology is how do they work? For example, if we're going to take just a random system off the top of my head, a kidney. All right, the anatomy of a kidney, you have, and I'm just going to start saying words. Okay, you do not have to furiously be writing these words down. It's just if you've heard them and you hear them, then when you are being taught them in med term and later in anatomy, you'll have already heard these words. So you have the medulla, you have the cortex, you have the functional nerves called the neuron, not the neuron, I'm sorry, the nephron. The neuron's a whole other system. The nephron, you have the greater and lesser calyx, which is a funnel that collects urine. That's all of the anatomy, the parts. The physiology is where we get into the functionality of the nephron. We get into how the descending loop of Henle dips into the medulla, and the salt, sodium chloride, promotes the retention of water. It's fabulous. Oh my God, the kidneys and the urinary system are so interesting. But that's the basic difference, the parts versus how do they work. So we have some different types of anatomy, and we are going to be getting started with the microscopic, micro meaning
small.
Small, very good.
Small.
Micro, tiny, scopic, which means you need to have a microscope. Even these words that you already know, guys, microscope is a medical term. Micro, small, scope, tool for looking at. Microscope, tool for looking at tiny things. Macroscopic, meaning large. This is stuff you can see with your bare eyes. So if I come up to you and I open you up and I pull out your beating heart, I can see the heart. Boy, that got a little violent right there. So here's your beating heart. I'm showing it to you. The tissue of the heart, that is macroscopic. But if I wanted to go in and take one, using med term, cardiomyocyte, cardio heart, myo muscle, site cell. Cardiomyocyte is a heart muscle cell. I can't see that. I would need a microscope. So that's kind of the difference between our macro and our microscopic. We have regional anatomy, which are the individual parts. So if we think of all of the systems that we probably already know, you have the respiratory system, the circulatory system, the nervous system, the skeletal system, the GI system. All of these are regions. They are systems that have jobs unto themselves, but working together, they provide systemic anatomy. So what systemic anatomy is what is the contribution of this one region and how does it contribute to the overall well-being of the animal? Because there's a lot of lop over. When we talk about things like, the reproductive, in fact, I just did for my bachelor's degree, so I think that's why I have it on the brain. I just had to do my midterm, which was a audio PowerPoint over a condition called a pyometra. Pyo meaning pus, metra meaning uterus. And this is an infection of intact bitches that their uterus gets filled with pus. Okay, well, that is not just contained to their uterus. Yes, we're discussing the regional anatomy, the reproductive system. But what ends up happening is that bacteria goes into the bloodstream and then it goes everywhere and it can affect the heart. It can affect the kidneys. It can affect the liver. And we are now seeing the contribution to the systemic. Systemic means all over the body. Does that make sense to everyone? When my eyes are doing this, I'm not having a stroke. You guys are on my upper. I have my laptop. I have my second screen, and then over here I have my third screen, which is not turned on because I don't need it right now. All right, so let's talk about some of these regional body systems. So as I said, I kind of mentioned most of these. The skeletal system is going to be your bones, and where your bones come together with other bones, which is where we have joints. Medical term for bone is osteo. The medical term for joint is arthro. You already know quite a bit. Another example of, regional anatomy, Deanna, is literally any of these body systems. We're talking about, think about, okay, the city of Houston, the body of Houston. But the regions you have, Fort Bend County, Harris County, wherever Katy is, I don't know. You have Sugar Land, you have Rosenberg, you have Katy. I live in Alief Mission Bend. Those smaller parts are the regions. As they work together to the body, is the city of Houston would be our systemic, the full body. So if you think of Houston as the body, you have all of these smaller parts that contribute to the health. And it's those smaller parts like skeletal, integumentary, which is your skin, nervous, cardio. Each one of those, think like skeletal equals Katy, integumentary equals Rosenberg, nervous system equals the Woodlands, cardiovascular equals Stafford, on and on and on. Each one of those is a specific region unto themselves, but they all work together for the greater good of the entire body, the systemic of Houston.
So that was, I'm sorry, that was really good for, at least for me. So the regions would be like Alief and Katy and the regions. And then the system would be Houston, and then the body would be Texas.
Yeah, if you want to break it down like that, that would be fine. If you don't want to go that one set or that grandiose, you could say that Katy and the Woodlands and all of those are the regions and Houston is the body. If you want to go bigger, you could say that Houston, San Antonio, Dallas are the regions, Texas is the body. So whatever is working for you. But that's kind of the difference between our regional and our systemic. Oh my goodness, I'm seeing a lot of people who are in Alief, and no, I'm not telling you where I live. Nope, that's not gonna happen. Although I will say that the Onyx, was it the Onyx? One of the cohorts, whenever I would accidentally say things about the area and the neighborhood that I live in, they would write it down. They were all going to try and find me. This is like this hoof, not hoof. I was looking at the word hoof. This huff scavenger hunt to try and find me. All right. So the skeletal system, each one of these represents a region. So the skeletal system, as I said, osteo is bones, joints is arthro. Guys, you already know so much. I know medical terminology is sometimes a little overwhelming. You have no idea how much medical terminology you already know. I'm telling you, the term for joints, the medical term is arthro. Without even telling you, what is the medical term for inflammation of your joint?
Arthritis.
Bam. Therefore, the suffix itis means Inflammation. Think of all the itis words you know. What happens? What is it called when your tonsils get inflamed?
Tonsillitis.
Tonsillitis. What would it be if my heart got inflamed?
Cardio.
Very close. Carditis.
Carditis.
If the inside of my heart is inflamed.
Is it myocarditis?
So myo would be muscle, the muscle itself.
Endo.
Yeah.
Endocarditis. Look at how much complex words you guys are learning on your 4th, 5th day. Endocarditis, just break it down. So bone inflammation would be osteitis. If you have an inflammation of your bones and joints, you have osteoarthritis. The integumentary system is going to be your skin. That's just a very fancy way for skin. Is the intro you have? Yes. You mean, Sean, do you mean like the how to learn, how to study, that sort of thing? Yeah, that's exactly. I really find it beneficial to introduce the study techniques because you can extrapolate that data and help across the board for every class. And I do a lot of medical terminology in anatomy because they are hand in hand. We have to use med term in order to discuss anatomy. So your integumentary system is your skin, dermato. Tell me inflammation of your skin.
Dermatitis.
Bam. Dermatitis. All right. A person or agent who studies would be an ologist. Therefore,
A
tell me.
dermatologist.
Down. Right there. And I know. Is it not exciting? So the nervous system. You have the central nervous system, which is quite literally named for where it is, in your center. It includes your brain and your spinal cord. But then you also have your peripheral, where if I'm saying you see something out of your peripheral vision, where are you seeing it shown? Out here, right? So if this is my central nervous system, everything branching off of it is peripheral. And so those are my 2 different types of nervous system, or not types, categories for this particular region. Cardiovascular. Well, we already know cardio, right, is heart. Vascular is the medical term for all of your blood vessels. We have some. Hamster, what are you doing? Sorry, Poppy's pacing. That usually means she's about to do something bad. You have some blood vessels that carry oxygen, and you have some blood vessels that carry carbon dioxide. This is known as oxygenated and deoxygenated. And you'll learn about these. You've got arteries, which carry oxygenated, veins, which carry deoxygenated, and all of them are in the category of blood vessels. If it carries blood, it is a vessel. By definition, a vessel means to carry something. You have your respiratory, which equals your lungs. Your lungs are just great big voids of air. And you have these specialized little cells and these specialized structures called the alveoli that allows the air that you breathe in to bind and enter into your red blood cells and then get transported throughout your body. You have trachea, which is your air tube that branches, it bifurcates, meaning going from 1 to 2. And these are our primary bronchi. And then it goes into smaller and smaller bronchioles. Eole means small. So bronchiole to your alveoli. Tell me, look at all this again, guys, look at all this med term. If you feel overwhelmed with medical terminology, you know so much of it already. What is an inflammation of your bronchi?
Bronchitis.
Bronchitis.
Bam! Do you see everything inflammation is itis? Everything. Bronchitis, tracheitis, gastritis, enteritis.
What's that one?
Entero is your intestines.
Oh, so
If you have, here's a term you've all heard.
inflammation of the intestines.
Gastroenteritis is inflammation of the stomach and the intestines.
Ah,
See, there's no reason to have anxiety. You already know so much. See, medical terminology, without getting too far off of anatomy, although they really do go hand in hand, medical terminology is heavily based in Latin and Greek. Well, guess what English is heavily based in?
Latin and Greek.
And Greek. You already know so much of this. So don't be anxious. Remember what we said. The more anxiety you have, the more cortisol you're splooshing into your system. You're okay. And if you guys are having trouble with medical terminology, you just let me know and I will incorporate it as I am doing into my lecture in anatomy because they all go hand in hand. All right, digestive, we just talked about. Gastrointestinal, the GI tract. It's also known as the alimentary tract. Sometimes we refer to it as the gut. And its whole job is to break down and convert nutrients into stuff you can use. When you eat that Chipotle burrito, I love Chipotle burrito, by the way. Oh my God, I'm going to go get a Chipotle burrito for lunch. I'm very excited about this prospect. I'm going to treat myself to some Chipotle. All right, so Chipotle burrito is alien. Your body doesn't know. It's not part of you. No, I get the burrito. A burrito, and my burritos are so teeny tiny, small, and adorable because I don't get any of the crap. No beans, no rice, just chicken. Now my mouth is watering a little bit. Okay, so the whole job of your GI tract, your stomach, when you eat the Chipotle burrito, your body is like, what is this stuff? I don't know what to do with it. Your stomach and your intestines, this is where anatomy, I am like, oh my gosh, this is miraculous. You guys, I get so excited.
That anatomy is called bubble guts from Chipotle. That's the anatomy of Chipotle.
Yes.
Bubble guts is like, that's the first thing. When you said Chipotle, I was like, oh God.
Oh my God, Chipotle.
Chipotle is bae.
I love Chipotle. But you see, now you know I have a Chipotle within driving distance of my house. Damn it. Or do I? Britt is making notes. Damn it, Britt. Britt's gonna have, you know, that meme with the guy with the cigarette and all of the strings. Yeah, that's gonna be all of you guys trying to find Miss Huff's house. I find that funny. Anyway, so your digestive system, when you're eating the Chipotle, your body, this is alien. It doesn't know what to do. Your stomach and your small intestines, their job is to break that apart to a molecular level. My body knows how to do stuff that my brain, my consciousness does not know how to do. I find that fascinating. It's going to break that protein and the carbohydrates, the sugars and the fats, the fatty acids, and break them apart into their most basic molecular structure. Send that to the liver, who converts it into glucose, and that glucose then goes around your body and nourishes your cells. That's crazy. That's crazy talk. Muscular, we just talked about this, guys. What was the medical term for muscle?
Oh, I forgot. Oh,
Myo.
Myo. Very nice. Myo. Muscle. We got 3 different types of muscles. We have skeletal muscle, which by its name is attached to your skeleton. This is the muscle that you can choose to move. So somebody show me a skeletal muscle. I can choose to move it. These act as pulleys on the lever system of my skeletal system. We have cardiac. Well, we already know what does cardiac mean.
heart.
Heart. We have a specialized type of muscle in our heart. And we have smooth muscle, which is what we also refer to as involuntary. Involuntary muscle means you don't get to choose to move it. This would be like your stomach, your small intestines, your uterus, your...
Like a twitch? Would that be one?
No, a twitch is an
That's a muscle
involuntary...
spasm, right?
That is a
Involuntary muscle
spasm.
spasm. Yeah.
A twitch, a spasm, a convulsion. All of those are going to be an involuntary movement of a voluntary muscle. I am saying, okay, so if I am talking about a voluntary muscle, all of your facial muscles are voluntary. So if I said to everybody, 1, 2, 3, I want you to smile and close your eyes. If you can choose to do it, it's voluntary. But if I now say 1, 2, 3, everyone move your duodenum slightly to the right. The duodenum
That's
is the
not
first. The duodenum is the first part of your small intestines. And Leanna, no, you didn't. I call you a liar to your face. You can't move it. So can you have an involuntary spasm? In fact, that's the medical term for it, is spasm. Of course you can. There's 1,047 things that can cause a voluntary muscle to move when you're not trying to. It's still
Dehydration
voluntary.
too, right?
Dehydration, calcium, phosphorus, sodium, potassium, all deficiencies of that. If you have
All the EMs.
deficiency-
No, I'm just kidding.
all of the EMs, all of the minerals that we're going to learn about next term. All right, so we have our sensory, which is all of your senses, your 5 senses. Actually, no, we don't have 5. We have 6, don't we? Doug, get on the wheel. Your eyes, your ears, your nose, your mouth, and your whole body touch. We do also, in fact, Ace, I think we were having a pretty interesting discussion about this just yesterday. Ace came over and got to see some of my collection. Everybody is welcome to come see the collection. It's pretty cool. We had a really interesting discussion over the 7th sense. Now, am I saying you're all psychic? Of course not. But I am saying that evolution has given us a remnant of a 7th sense, an ESP, extra sensory perception. Again, I'm not saying that you all are psychic. Lizette, you raised your hand.
Yeah, I have a question. So, when you go to the doctor and they like check your thyroid, would that be considered the involuntary or voluntary?
Now, your thyroid is neither. Your thyroid is a gland, which is a whole other type of tissue.
Oh, okay. I just wanted to clarify that. Thank you.
Every single one of these body systems is made of its own type of tissue. So bones are made up of skeletal tissue. Your respiratory system is made up of lung tissue. Thyroid, glandular tissue. So all of these are different types of tissues. Not everything is a muscle, because a muscle is in fact only a small percentage of the types of tissues that you have. Does that make sense? So our sensory, we do have this extra sensory that is left over from evolution when we were both predator and prey. Have you ever been in your car and your jam comes on the radio? You know, those days where it's beautiful outside, your windows are cracked, and you are just belting it out, eyes closed, hopefully at a stoplight. Don't do this while you're driving. It's like, I'm driving and singing with my eyes closed. And suddenly you just feel that tingle on the back of your neck. There's nobody else in the car with you, but you just feel that weird feeling, and you look to the side and everybody in the car is looking at you. Yeah, I used to do an experiment pre-COVID with you guys when we were normal, and I would bring 5 or 6 of you up onto the stage, and I would take off my lanyard of keys. I'd take off my shoes so I was silent like a ninja. I would have every one of you just stand with your eyes closed, standing towards the other students. And I would not touch you. I would not make a sound. And I wouldn't come like where I'm like leaning up as the big spoon, but I would just come up and stand probably about 6 inches behind one of you. 100% of the time, you would shiver and step away. 100% of the time. That is just our extra sensory. When you are looking at someone and suddenly they look up. I used to do this when I found this kind of interesting. Again, pre-COVID, when we used to do all of your testing on campus, and I would pass out a paper test, and you would sit and I would watch and proctor the test, and you would take the test. And so you would all be, down like this, taking the test. And I'm not like being creepy. I'm just, letting my eyes kind of wander. And if I accidentally just kind of settled on one of you and just let my brain go for a minute and my eyes just settled on one of you, nearly 100% of the time, that person would look up at me and be like, what is happening? And no sound, no nothing. And it's part of the fight or flight from when we were prey animals. Because the interesting thing about humans is we have been both predator and prey. And so we have this evolutionary response. Prey animals do have this heightened sense. If you've ever watched any of the nature shows, when you have a herd of gazelle and the tiger is creeping invisible towards them, and one lifts his head up and boop, off they go. None of them saw it. None of them smelled it. They just had a sense and they followed it, and they saved themselves. That's sensory. I find that interesting. Endocrine. All right, Lizette, this is one of the glands that belongs in the endocrine system, thyroid. Endo, we already know, means inside. Crine means into your blood. So these glands are going to deposit whatever it is they're making directly into your blood. Thyroid produces thyroid hormone, which goes directly into your blood to regulate your metabolism. Pancreas makes insulin, goes directly into your blood and helps regulate your blood glucose, etc., etc. Urinary, we talked about this a little bit at the beginning of class. We've got the kidneys, nephro, reno are the 2 words for kidneys. So you've got 2 kidneys. You've got 2 ureters, which attach the kidneys to the bladder, where you only have 1. And then you have the one tube from the bladder, which is called the urethra. All animals, male and female, have all of these same parts: kidney, ureter, urinary bladder, and urethra. The biggest difference is going to be things like the length of the urethra, the configuration of the urethra, the opening of the bladder. And we're going to talk about all of that when we do get into the urinary system. But yeah, kidneys is reno or nephro. So if I have a nephritis, that is an inflammation of the kidney. If I am a nephrologist, that is a person who studies kidneys. And then finally, reproduction. Boys have a penis, girls have a vagina. That one's pretty self-explanatory. Male and female, regardless of whether it's a cat, a dog, what have you, they've got all the same parts that we do. Males have a prostate, which nourishes the spermatozoa and provides protection from the acidic environment of the female vagina. Females, everything about a female, and this is where I find, again, evolution really interesting. Everything about a female is set up to seek out, find, destroy, and murder sperm. That's exact. We are acidic. The environment inside our body on a pH scale is more acidic than a male. And so when the male ejaculates and the sperm comes in contact with the female environment, automatically they are the wicked witch of the West, melting. I'm melting. They are getting acid poured on them, essentially. Not only that, but our entire white blood cell military is coming in and launching a massive attack. And so what the prostate does is it has this prostatatic fluid that kind of coats and covers like a shield, like a suit of armor. And that's what allows the little sperm to go in and, fight off our immune system and survive the acid environment and hopefully get up and, fertilize an egg. Also helps have nutrition because it's a very long, very dangerous journey. And he needs his little sandwich. So he's got his little lunch pail. And he's got his suit of armor and his little lunch pail, and off he goes. So that's reproduction. So all of these, this has just been a basic introduction into these body regions. So why do we need to know all of this anatomical terminology? Well, number one, we're medical professionals. It's kind of important that we understand what our doctors are saying. The other thing is, as I said at the beginning of this lecture, all of the technician's job is to interpret and then educate our owners. We need to be able to identify, interpret, and then translate, no different than a translator for any other language. If my doctor is speaking Spanish and my patient's owner only speaks English, I need to speak both. Now, obviously, does my doctor know English and med term? Of course. But let's just do it very black and white. My doctor speaks medical terminology. My owner speaks layman, which is the term for not medical terminology. I am the one that needs to translate it. Now, I also need to be able to mentally visualize specific areas on my animal. Just like Tony Stark has that wonderful computer that he's able to lift up and then manipulate. I need to be able to create a 3D image of my patient and manipulate it in my head. But we do have an ability to break it down into smaller sections. And these smaller sections are known as planes, anatomical planes. And these planes are going to separate the body. We have one plane that separates the body into a right and left half. We have one plane that separates the body top from bottom. And we have one plane that separates the body back from front. So these are our anatomical planes of reference. The first one is known as the sagittal plane. And the sagittal plane is a plane that runs the length of the body and separates it into a right and left half, but not necessarily equal. So if I have separated myself here, it's separated left from right, but not equally. Separated left from right, but not equally. That would be a sagittal. That's how we say that term, sagittal. The other thing that I do want to kind of warn and make you aware of, as we are going through these terms and these planes, I encourage you to mark them out on yourself. Apparently everyone in this class is a huge fan of unicorns. So go grab the closest unicorn you have and practice your planes. However, the thing I need to warn you about, dogs and cats, are quadrupeds. They are going to be standing like this, not like this. This is biped, quadruped. So I encourage you, oh my Lord, Giselle, if you need a unicorn to borrow, Zoe, you said it at the beginning, I have 1,000 unicorns in my office.
I love it. Thank you.
So you are welcome.
I was thinking the same thing.
You are, although guys, it doesn't have to be a unicorn. You do know that, right? Like
I think that's our spirit animal for the class.
Just pick. Look at this cute little buck. This cute little tuckus right there. Anyway, my whole point is, if you're practicing this stuff on yourself, absolutely perfect, fine, no problem. But remember, on the test, when I do eventually test you, all of this is referring to an animal in this position, not this position. Now, when we're dividing left from right, it doesn't really make a difference if we're in quadruped versus biped, does it? Where it does start to make a difference is when I'm separating head from tail. If I am a biped and I'm separating head from tail, I cut across here, don't I? Does everyone see that? If I take a pair of scissors and cut, they've separated the head from the tail. But now it's here, right? Same plane, cutting in the same direction. It just, you mentally have to go, okay, here, here. Your brain gives you a false illusion that it is a different direction. But does everybody see that? Here. And actually, and yes, you're all welcome to bring your unicorns to class. I have no problem with that whatsoever. Let me see if I have my... All right, so just for example, here I have my unicorn, and I'm going to use this measuring tape right here to do an example of separating. Now, this is called the transverse. We haven't gotten there yet, but that's okay.
Yeah, that's not the sagittal plane, right?
No, this is not. This is a sagittal plane. Separate. So I'm getting ahead of myself. Hannah, thank you for bringing me back to reality. So this is a sagittal plane. Anything that separates this animal into a right and left half, but not necessarily equal. Mid-sagittal, mid meaning what?
The middle.
Yep.
The
This
middle.
is separating the animal into a right and left half, right
Equally.
down the middle, right down the midline. My camera is opposite. I'm having trouble here. So right down the middle. There we go. This is a mid-sagittal. Sagittal is the word for from left and right. Mid means right down the middle. So mid-sagittal, right down the middle, equal right and left halves. Sagittal, without the mid in front of it, sagittal just means right and left half, but not necessarily equal. Does the sagittal, mid-sagittal make sense to everybody?
Are mid-sagittal and sagittal spelled differently? I see that sagittal and mid-sagittal. So mid-sagittal has
Yes,
2 G's
one
and
T, yeah.
sagittal has 1 G.
Yes.
Thank you.
So again, so anything that has the word sagittal means I am separating my left from my right. If it is mid, it's going right down the middle. If I just have the word plain Jane sagittal, it's still left from right, but not necessarily equal. And so instead of getting caught up in the direction, I like to refer to all of these planes as I'm separating what from what. Because if you start thinking about separating what from what, suddenly it no longer matters if you're looking at yourself in the mirror as a biped or if you're looking at your animal as a quadruped. Because regardless, separating left from right is separating left from right regardless of what you are. So sagittal is separating left from right. That's just the way that I find it easiest. Because if you start thinking about, okay, well, it's separating from head to toe, well, but there's another plane that does the same thing, just separating 2 other things. So I suggest sagittal, you hear the word sagittal, immediately you think left from right. Transverse means across.
I have a question. So
Yes.
is sagittal, could it be like a diagonal sagittal from right or down?
I mean, theoretically, yes. We could have something like this, separating the right from the left. But for what we need, because you're on this level and we're down here. So we'll just pull you on down. All you guys need to know, the word sagittal means separate left from right. That's it. Transverse means to separate the head from the tail. And if you think about it like this, separating head from tail, suddenly, again, it doesn't matter if you're separating a biped head from tail or a quadruped head from tail. Transverse plane is going to cut across like this. Do you see how if I cut this animal right here, it separates the head from the tail? But you can also see when I turn this animal into a quadruped, okay, so I'm not moving my plane, right? Everybody sees the plane, but now I'm going to turn it into a quadruped. Do you see how my plane, it did not change? Now it appears like it did. It's kind of an optical illusion, but I'm still separating what? My head from my tail. So this is the transverse plane, whether you are on 2 feet or 4 feet.
Is that how you would like cut in surgery, or would it be like
No,
like down?
no, you're always going to, in surgery, use mid-sagittal.
Okay,
Depending
that's
on
what
the, obviously, depending on the surgery. But if you're doing a spay or if you're doing a laparotomy or something like that, you're gonna do mid-sagittal. We're not gonna decapitate the animal. Because
And then for mid-sagittal, isn't that when you're doing like for spay and neuter, that's more for like the cosmetic look and effect of it, or is it
Well,
really because you do need to go to mid-sagittal?
no, you do need to go to mid-sagittal because you have a very real line that separates your body into a right and left half. It's called the linea alba. And so what we want to do is cut the animal on the linea alba and not through a muscle. If you start cutting that animal's muscles, the muscle tissue does not heal back very well or very quickly. The linea alba, however, does. And so I don't want to compromise the abdominal muscles, and I want the animal to have an easier time to recover from the surgery. So I am going to cut them on the linea alba, which is on the mid-sagittal plane. Does that make sense to everybody? All right, wow.
Yes.
Oh, we got 5 minutes. All right, so my transverse separates head from tail. And then finally, my dorsal, think of, if I say to you, I'm looking at a dorsal fin on a fish, where is the dorsal fin?
On the top?
Backside.
It's on the back. So my dorsal plane is going to be separating my back from my front. So the dorsal plane is down here. If I do use my tape here, I turn my unicorn sideways and I am now separating the front from the back. That is my dorsal plane. So again, on me, mid-sagittal, separating my right from my left in equal halves. Sagittal, 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 sagittal.
Would the bottom part of dorsal be considered the subdorsal part?
It would, but we're not on that level right now. You just need dorsal. Dorsal means your back. Ventral means your front. Transverse. Stand up here and do a little dance. All right, so we have mid-sagittal, sagittal, transverse, separating what from what? My head from my tail. Do you see if I am a quadruped, I am still separating my head from my tail. And then here, dorsal plane, separating my front from my back. One last little analogy. Okay, so there's this terrible campy movie that was absolutely fabulous. Some of you may have seen it. It was called 13 Ghosts. Have some of you seen it?
That's what I said in the comments.
I didn't see the, yes, Charles 13 Ghosts when he was split and he's like, ah, and this huge pane of glass comes down and burp, and he's like, eh, and then his front part slides down the glass and his back part is still stuck to it. Dorsal plane. Dorsal plane. There was yet another stupid campy movie called Ghost Ship. Charles is on my, you're on my level, my friend. Ghost Ship, the beginning, it was a terrible movie. It was awful. But the beginning, the opening credits, They're having this lovely dinner. The captain's dancing with this little girl. It's adorable. It's a lovely evening. And this giant wire, this nefarious person who we don't know, is winding this wire up super tight, and then he lets it go, and it goes, and it cuts everybody in half, and like parts of them are sliding off. It's fabulous. That's the transverse plane, separating their head part from their tail part. So those are two for my visual learners. Those are two little snippets that you can look at to physically see a transverse plane separating head from tail and a dorsal plane separating front from back. Comments, let me get in here. Comments, questions, concerns?
So I have my bear. Can you go over one more time, just so, because I'm a visual learner and hands-on. So can you go over one more time, each one with your unicorn?
Absolutely.
Thank you.
Mid sagittal, separating the body into an equal right and left half. Sagittal, separating the body into a right and left half, not necessarily equal. Transverse, and it's anywhere. Transverse. Transverse, separating.
As long as it separates the head from the tail.
Head from tail.
Okay.
Dorsal, separating the back from the front. So again, anywhere, dorsal, 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 separating back from front. And if you guys want to bring your happy unicorns with you on Monday, group A and group B, just have them with you. We can certainly use them as our Kingsman. They did. Kingsman also had dorsal and transverse when he was in the church, like he was cutting people in half, and yeah, there's a lot of them. So anyway, have a most fabulous weekend, my darlings. I will see my live studio audience on Monday, and bring your unicorn if you want. You don't have to, but if you want to, that's fine. And we will review our planes. We're going to start talking about our directional terms. So everybody do a little read ahead and start looking at your directional terms. And I will see you all on Monday.